For those who are talking, I see the death panels. I see what y'all say. You know what the death panels are? Denial, denial, denial. That a lot of
right. That's right.
That's the truth. That is the truth. I would submit to you that I would say that this is an incredible challenge that our country faces right now. It's tough. President Nixon, who was Republican, I think we all know that, tried to do this and couldn't get it done. Bill Clinton tried to do this and couldn't get it done. This has been worked on for 4 decades. We've been working our tails off for 9 months. We need to make sure we get it right. And that's why I've been trying to do and to listen these past few weeks. And I have listened to you. We have worked and worked to make this right. Is everybody going to be here, going to be happy? Absolutely not. But if we come together to unify, to meet this incredible challenge that we have right now in America now, we will be able to look in a mirror and say we did everything we could. Because right now in America, there's 20,000 fellow Americans in our country right now that die every single year because they don't have health insurance. There goes the bubbles. There's 510 fellow Pennsylvanians every single day. You need to listen to it. 510 Pennsylvanians, our neighbors, that get kicked off their health insurance every single day. 510 yesterday, 510 today, 510 tomorrow, and if you want to stay the status quo, guess what? When they knock on your door and they give you that denial letter, and then you ask us, I'm going to be able to say to you and look you in the eye and say, I did everything in my power to anticipate the problem. We're not necessarily in the 11th hour. If we wait 10 more years, we're going to be in the 11th hour and it's going to be too late. This is our chance to get it right. This is our chance to get it together. This is our chance to be American. One last comment on some of the naysayers out there. Please listen. The folks that are saying public option, I'm a supporter of public option. And ma'am, I hear the cat calls, ma'am. Yes, I am going to go with a public option. Yeah. If it's good enough for Americans, it's good enough for Maggie Murphy, and Patrick Murphy, and Jenny Murphy, and God willing, Jack Murphy, and he's 42 months.
Yeah! Yeah!
Because when you are commissioned as an officer, whether you're in the Marine Corps or the Army, you make sure you take care of your soldiers. When I was in Baghdad, I said I made sure that my men ate before I did. That's taking care of soldiers. Well, now it's time to take care of all Americans. To give them a choice to be able to have a public option. And that public option for those working poor in Bucks County, because there's 60,000 of us that have no health insurance. 9.7%. Those who are working poor that can't afford it, that make $35,000 a year. We're giving them not free care. We're saying we're going to give you subsidized care. And it's not subsidized care to go in and get a public option. It's saying whatever you want. If you want Blue Cross Blue Shield, here's a subsidy, and you have to pay premium or co-pays. Go get Blue Cross Blue Shield. Go get that. Go get that out there. We'll go get the public option. It's putting American competition back in the system, which has not been there for far too long.
Right on.
I have a town hall September 17th. I hope you come there. Because you'll be hearing the same exact thing that I tell people who are for reform and people that are against reform. But I will tell you, to those who have been against this, and I've been listening to you. I showed up at your protest when you're protesting me. And I've listened to you. And I've brought my bill with me. And I showed you that there is no care for illegal immigrants. That's false. I showed you that there is tort reform measures in here that pass that committee that are part of the bill. I've showed you that it's not socialized medicine. It's doing the right thing to make sure we can have the current system but tweak it to make it better for all of us, not just for the wants and the whatnots. That is what America is about. Yeah. That is what America is about. It's for Joe who has that small business who talked earlier but wants to do right by his employees and make sure they have coverage and he can help his company grow. It's for Cynthia to make sure she can do what's necessary. Her husband David doesn't have to pass is for Tam, who lost her niece. Because she didn't have health care. In our country, in this year, that's under all of our watches, not Patrick Murphy's watch or President Bush or President Obama, that's our watches. So we need to make sure we do everything in our power in the next few weeks and months to get this right. This is our one chance to make history. To do right by our brothers and sisters, do right by our neighbors, and do right by the United States of America. Thank you so much. God bless all of you.
Congressman Murphy, get it done now! 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 Murphy, 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 Murphy.
Thank you, Patrick Murphy, for your words, for your support, for your passion in trying to help the citizens of this county and the citizens of this country to be covered by health care and not be left out of the system.